Listen-only mode.
Hi, good evening. This is Tal Lee. I am the editor of First Aid for the USMLE Step 1 and Chief Education Founder of USMLE-Rx and Scholar-X. Welcome to tonight's talk about First Aid for the USMLE Step 1, the really short version, and the path to 250. Also, by way of background, I am an Associate Clinical Professor of Allergy Immunology at the University of Louisville. So, I'm also a university educator. So we'll get started in just a little bit. I do want to introduce a couple of our panelists. There's some fine folks that are going to help answer some questions tonight. So want them to say a bit about themselves. So first one is Sean Nanji.
Hi guys, Sean Nanji here. I've been with First Aid for the better part of this year, helping them with RX Coach, and we'll talk more about that later today. I look forward to answering your questions.
Great, and our other panelist is Mark Heslin.
Hey guys, my name is Mark Heslin. I'm a third-year medical student at Cooper Medical School of Rowan University, and I'm helping out the tutoring program for Scholar-X. So I'm looking forward to answer your guys' questions.
Great, fantastic. So there will be there's a question panel on the right side and of the screen. If you're, let me see if I can get my arrow going here. Right here, if you're on a computer like a PC or a Mac, if you're on an Android device, tablet, iOS, whatever, it's probably one of the drop-down menus at the top, and you'll be able to ask questions of Sean and Mark with regards to USMLE, passing, tutoring, that type of stuff. So, they'll be answering questions throughout this presentation. So let's get started. So, the first word in First Aid is relax. This is we just went into our 30th edition. It's going to publish any day now. We've always talked about just getting relaxed, centering yourself before you prepare for the big exam. And we'll talk, and this will be a theme throughout our discussion tonight. So how are we going to approach this talk here? We're going to talk a little bit about the basics, and we're going to talk about defining your goals, timelines for study, approaching each subject, choosing prep resources, some additional advice. We'll talk about bricks and RX Coach, which is what Sean and Mark are working on. And then we've got a really special raffle tonight. We're going to be raffling off a package of bricks, RX 360 and RX Coach. Each package is worth roughly $1,000 in terms of coaching and USMLE resources. And then we'll also have a special holiday offer as well. And then at the very end, we're going to hopefully hang out for some Q&A. So if you got some questions, they weren't answered, through the Q&A box, we're going to try to then, discuss it, as a group. So with that, let me just dive in. All right, so first we're going to start with a question. I want to know who's out there tonight. We got several hundred folks out there, and so it's a great crowd, but I want to know a little bit more about you. So I'm going to launch a poll, and I want you to answer the poll questions. Should be in your on your screen right now, and we'll this will make sure that you guys are awake and interactive. So I'll wait about a minute or so, give everybody a chance to participate. It does take a little time for this poll system to tally, so I apologize for any delays, but we do want everybody to be able to participate. I'll wait a couple more seconds. Looks like about half of you folks have voted. I'll wait for another 5-10 seconds. All right, 2/3 of you. All right, about 3/4 of you folks have voted, so we've got a pretty good idea who's out there. I'm going to share the results. As you can see here, the majority of the folks that are out there are international students or graduates. We've got obviously a fair number who are also in North America as either U.S. or allopathic students, or as U.S. born or Canadian born, North American born IMGs. All right, so the next question is, let me pop that up, is when do you plan on taking the USMLE? Is it right now, or is it sometime next year? All right, so take a minute to answer that question. Again, it does take a little time for the results to get tallied, so we'll be patient and let everybody pick an answer and come in. All right, looks like close to half of you folks have voted. And all right, looks like we got 3/4, so we're good. So let me share that and share the results. And you can see it's escalating to next year. So some folks will take it early next year, but the majority of the folks are going to be taking it later in the year, so mid 2020 or beyond, which is expected. Okay, great. All right, so let's talk about the basics of the USMLE Step 1. Some of you folks already know this, especially if you've downloaded the USMLE orientation materials. But to make sure we're all on the same page, I'll just go through the basics. So this is a one-day exam, so 8 hours in total at a Prometric test center. There's 280 questions in 7 1-hour blocks. And so that works out to 40 questions per block. And then there's a minimum of 45 minutes of break time. So you can see, by the schematic here, that you've got these blocks. This is actually an orientation block. We'll talk a little bit about, but you get your blocks throughout the day, and then at some point you're gonna take a meal or you're gonna take some breaks. The key thing about the orientation block is that this orientation block is already available as a USMLE download, and so if you actually go through the orientation and beforehand, you won't really have to go through it, when you're at the Prometric Testing Center. The only thing you need to do is log in, and because there's one area where they will allow you to adjust your headphones for the handful of multimedia items that are on the exam. And if you do that, it'll just take 1 minute. You'll have 14 minutes of break time to add to the 45 minutes. And so you should be close to an hour of break time. The other thing that you should know is that if you finish any of these blocks early, so again, they're all 1-hour blocks apiece, 60 minutes. If you finish any of them early, the time that you have there also contributes to, again, your break time. All right, so in general, you should be able to get enough break time for lunches and potty breaks and all that usual stuff. All right, so what is on the exam? So it's quite simple. It's down to the single best answer. So it'll be a multiple choice question. A minimum of four choices, sometimes 5, sometimes 6 or 7, and again, it's the single best answer. A couple of them will have multimedia. The majority of them will be case-based. Most of them will be case-based. 85% or above, roughly. So this number actually needs to change a little bit. And the majority of them are multi-step. So that means they are integrated, multi-concept questions. It may start with some biochemistry. I would end with some pathology or so forth. So here's an example of one. So you have a 32-year-old Caucasian woman who presents with a 5-day history of occasional double vision and bilateral ptosis. And then it asks, what is the most appropriate diagnostic test? So right away, you get that, this isn't really a one-step question, because it's actually not asking what the diagnosis is. Of course, you need to figure out what the diagnosis is. You need to have some idea what's going on, but really you're using that then to get to what you think is the most appropriate diagnostic test, right? So that's what the actual question is all about. So this is a 2-step question, and you go back and you look at the history and the presentation. A young woman, Caucasian, with double vision and bilateral ptosis that's been going on for about a week. This is mostly going to be something like myasthenia gravis. You could argue for something like multiple sclerosis, but you would more likely see that in somebody who has unilateral findings and African American, though it obviously going to occur in Caucasian women as well too. So again, if you think it's myasthenia gravis, then what is the most appropriate diagnostic test? Well, if it's in North America these days, it's going to be anti-acetylcholinesterase antibody assays. Historically or classically, it's been the tensilon test or short-acting, idrophonium, which is a short-acting acetylcholinesterase. That's the classic answer. But that drug's really no longer available in the U.S., though it's still available in other parts of the world to be used as part of the diagnostic test. But again, that's again an example of a 2-step question. And again, on the boards, you may see 3-step questions. and you'll often see problem-solving questions where they'll give you some data, especially for some of the public health or epi-biostats questions, and you've got to solve for prevalence or incidence or things like that. Or you may be given some test result, or I'm sorry, scientific results, and maybe a gel or some RT-PCR results, and you have to interpret that. Okay, so what does the interface look like? What happens when you get to the Prometric Test Center? Well, it's very simple. It's a very simple computer interface. When you sit down and you take a look at the question, you'll see that almost all the time, as I mentioned, there is the vignette. It's technically called the stem, and then there's the question that's tied to the vignette. So in this particular case, which of the following is the most like doses, which is actually one of the more common lead-ins or questions on the USMLE Step 1. As I mentioned, you'll see 4 to 7 choices, and about 15 to 20% of the time, you're going to see some image, diagram, chest X-ray, clinical imaging, and so forth. You've got your navigation tools across the top and along the sides, and then you got your timers at the bottom for the block, and then also for the rest of the day. You can lock the block if you need to go out for a pee break or something like that, but the clock will still tick. And as I mentioned, if you exit the block before the full 60 minutes, the remaining time feeds into your break time. The other thing that you'll want to know is that while you are inside a block, you can go back and change the answers to any of these questions before you exit. But however, as soon as you exit that block, you'll no longer be able to go back and change your answers. So you got to go on to the next block. All right, so let's talk about scores and passing rates. So passing has been at 195 for the last couple of years. A number of folks have been asking about pass-fail. A decision about whether a recommendation about whether that would go pass-fail to all the governing bodies of the USMLE or the stakeholders should be announced sometime this month. So we'll learn soon in a potential timeline. But for most of you folks who are taking the exam in the next 4 to 6 months, it should not really matter. You should assume it's going to be continue to be a scored exam. The mean is around 229, 230. It kind of bounces around, but generally has been rising over the past couple of years. And the standard deviations are roughly 20 points. If you are a allopathic or osteopathic medical student, you're generally going to pass on the first try. If you're an IMG, you're generally going to pass within 2 or 3 tries. The pass rate for the first time bounces around the high 70s, low 80s, so roughly 78 to 80%. And so that applies to whether you are a U.S.-born IMG or an international-born IMG. So just keep that in mind. All right, and so these are the USMLE percentiles. We took the data from USMLE.org and we graphed it out. And this is the most recent data. And what you can see here is the median, which is around here, is roughly again 230. And then again to get to that to get to that 250, that's going to put you roughly at the 85th percentile right there. And you can see that most people flatten out at around 270, 275. You're not going to really see too many scores above that. Minimum, as I mentioned, is 194. All right, so let's talk about defining your goals. So we like to keep it really simple. So you either want to pass comfortably, right? So one standard up to the mean, but maybe one standard be as low as one standard deviation below. Beat the mean, so 230 or above, or ace the exam, which is one standard deviation above. And again, a number of you will be potentially looking at higher numbers, especially if you're considering some of the more competitive specialties. And so these are the specialties that classically have a ton of applications. They're very competitive, and the training program directors often use the USMLE Step 1 as a screening tool. And so this is the mnemonic, Roads to Riches. So that includes radiology, radiation oncology, the surgical subspecialties, the 3 O's and U's, aesthetic, which is plastic surgery, and dermatology. All right, and so here's some data that generally supports this. And so what you see here is median USMLE Step 1 score by specialty for matched US seniors. This is coming out of the NRMP, charting outcomes in the match, and they publish this data every year. So you just go to this link here and get the information. But you can see here, in general, if you're interested in one of the big primary care specialties, or even something like general surgery, as long as you're in the in the general mean, again, high 220s, low 230s, you're going to be fine. And again, you can see that there's big whiskers, whisker tails, where people are even below 220, and they're generally fine. Now, if you want to do something like, again, diagnostic radiology, the surgical subspecialties, plastics, neurosurgery, my brother was otolaryngology, then you might want to aim for a little higher, so you can kind of see the jump right here, all right, in terms of the scores and the interquartile means. But I do want to make sure that you do put this in context. Now, this is a really old chart, and it's not even available on NRMP anymore. I don't even think they update this graph anymore. But so the data is old. But so try not to spend too much time looking at the numbers, but look at the overall shape of the graphs. And what I'm going to point your attention to is, if you are a U.S. medical student, as long as you as long as you're interested in a major specialty, like not a competitive, but major specialty like medicine, pediatrics, family medicine, even if you had failed, your probability of matching is still going to be pretty high. If you are a IMG, you're going to have a flatter curve. There is a dose response curve. If you are a U.S. medical student, again, but you want to do something very competitive like otolaryngology, there's a steeper dose response curve. Pardon me, let me just mute that. So this just gives you a general sense of how the data plays out. All right, so I'm now going to ask a question, which is what is your USMLE Step goal? After hearing a little bit about this, do you want to pass comfortably? Do you want to beat the average, or do you want to ace the exam? So everybody take a couple of seconds to review the choices, and then choose an answer. And again, like I said, it'll take a little bit of time for it to percolate through. So we'll wait for your answers to roll in. We're roughly at around 50%. All right, 2/3. We'll wait a couple more seconds. Okay, looks like we've got most of the answers. So I'm going to close the poll and share it. And as you can see, the majority of you folks want to ace the exam. About 1/3 want to beat the average, and there's a handful that says, hey, just passing comfortably is perfectly fine. And that is perfectly fine. I had a classmate who did that. She did perfectly fine, got into her first choice. Now, she was going into psychiatry. So, again, there's no right answer for any person, but obviously the ultimate right answer is you do have to pass the exam. And you want to make sure that it doesn't shut any doors to any specialties that you are considering. All right, I'm going to hide the results, and we're just going to move on. All right, so let's talk about timelines for studying. So in first aid, we try to keep it very simple. We have a just pass schedule. So that's typically a couple of months, maybe 3 months. And it does involve, using first aid as a framework for organizing your studies. So that's where you, and then you complement with crammable subjects. We'll talk about that. You're going to do at least 2 question banks. If you need to do better, if you need to, score well above average, or you historically have had challenges with standardized exams, you may spend more time, and some people will spend many months preparing for the exam, and so it's everything in the just pass schedule, plus it's going to be everything else, the less crammable subjects, and you're going to often be doing 3 question banks or sometimes even more. And again, we'll talk about the rationale and the evidence for that. All right, so now let's talk briefly about study strategies. So one thing that you need to respect is your own learning preferences. You have taken high stakes exam before, the MCAT, SAT, and so forth, and so you generally have a methodology for preparing. You also know that you'll need to allot time and focus based on the structure and characteristics of a subject. So for example, in terms of strategies, if you are looking at micro and farm bugs and drugs, often flashcards and tables help because there tends to be a lot of regularly recurring types of associations and concepts that works well with tables and flashcards. Whereas if you're studying physiology, it may be more about relationships and understanding what goes up and what goes down, what inhibits, and then so that may be more with mind melts. Same thing with metabolic pathways. You need to understand the structure and characters of your own curriculum, right? So what's the strengths and weaknesses? And so if micro is not generally well taught at your institution, then you might be picking up some external resources to prepare for that. And then finally, the time assigned to a particular subject or system. So again, if you're going to be doing, if you're going to be prepping for pathology, which is often a huge subject and requires a significant amount of time, you're going to be using more in various study strategy versus something like neuroanatomy or embryology, where you may be doing 1 or 2 days of dedicated studying and maybe some scattered studying throughout the year. All right, so in the next 5 to 10 minutes, I'm going to go discipline by discipline, talking about generally what's high yield, low yield. And the good news is that you don't have to like scribble all this down or take screenshots or this, that, and the other. All these slides are on our blog at firstaidteam.com. We'll show you where that is and where you can grab a recent version of my talk. So I would strongly suggest you sit back and then just really kind of capture the big picture. As I go through these slides pretty quickly. And like I said, I won't read through all because it's all going to be in the slides. So anatomy is going to be low yield when we talk about gross anatomy, but what tends to be high yield, and this is going to be true for almost every discipline, is anything that's clinically relevant. So with anatomy, it's going to be any anatomy tied to a specific condition. So obviously landmarks when you're thinking about appendicitis, traumatic injuries. So if you have a spiral fracture of the humerus, you may be asked about what motor and nerve deficits you might have in your hand, and you might have to think about, well, hey, what nerve goes through the humeral groove? So if it's injured, then I have those motor and sensory deficits in my hand. Neuroanatomy, embryology, these are obviously discrete disciplines within anatomy. They tend to be high yield because there's a lot of because there's only a hand the USMLE tends to stick to a classic set of topics, and they also and also these topics often lend themselves, particularly embryology, to case-based vignettes and multi-step questions. Structural anatomy will show up on the exam, but often as clinical imaging. So X-rays, CTs, MRIs, and then also as clinical histology. So that also includes EM in addition to photomicrographs. All right. So biochemistry is one of those crammable subjects I talked a little bit about. So even if you're just doing just to pass, you're going to spend some time here. And so things that do tend to be crammable or that tends to be high yield, again, include anything that has clinical relevance, right? So ding, 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 just keep that in mind. And so vitamin deficiencies, diseases that have, metabolic diseases, disorders, anything that has a genetic error. And you got to think about the key regulatory enzymes that inhibit or the substrates that are involved in any of those any of those disorders. And so that's kind of where we talk about the biochemistry. And then with lab techniques, it's really about how science is discovered, right? And so think about the various techniques: Southern blot, Western blots, ELISAs, flow cytometry, all those various techniques. What kind of data did it produce, and then how do you interpret that, either in a scientific sense or in a clinical sense? Because obviously some of these same tools are used in clinical diagnostic medicine. All right, micro is also one of the big crammable subjects. So you're going to hit it whether you're just looking to pass or you're going to do really, really well. Just keep in mind that it's more than just bacteriology. There's all other kinds of subject areas involved. But that being said, the information does tend to be more organized, because they often the association, the conceptual association, is all about how to identify them in the lab, or make the clinical diagnosis. Where do they go to? How did they get there? What may be the reservoir or the vectors? Is it rats, mice? Is it in deer populations? And then how do you treat it? On the immune side, it's really knowing about how the immune response works clinically. How does it work in normally? How is it manipulated by vaccines? And then also what happens when the immune response goes wrong, especially with immunodeficiency diseases. All right, so we already talked about pathology being huge, so I don't think I need to convince you of that. But that says, within the various conditions, the USMLE does tend to stick with hallmark characteristics, especially if it tends to be a rare and unusual disorder, but has a great mechanism that's testable and perhaps generalizable. If it is a major condition like asthma, for example, you are often going to see sometimes more variants. So, for example, it's very common for children who have asthma to just present with coughing. They don't necessarily have to have shortness of breath and wheezing. Speaking of the patient, the clues should either be neutral or they should help. They should not be red herrings. Now, just keep in your mind that not all sarcoidosis patients are African American. Not all, just as we said a little earlier, that Caucasian women can also, and perhaps men can also have multiple sclerosis. So just remember that there is a distribution, and there's only a handful of pathognomonic type scenarios that actually do show on the USMLE Step 1. Now, in first aid and in other high yield resources out there, you often see mnemonics and trigger words and buzzwords and whatnot. So they are obviously helpful as memory aids and mental shortcuts. But on the USMLE, you need to know how they are actually described. And again, if you do plenty of USMLE style questions, you'll get all those trigger descriptions. And then finally, as I mentioned, path questions is often where you get some of the gross specimens, gross pathologies, some of the clinical imaging, and so forth. The key thing there is that it's often tied to the key thing about these images is that you can often solve the question without even looking at the images or even the multimedia. So I strongly urge you that when you get to that, focus on the STEM, focus on the story, focus on your technique, and then after you read the STEM, then you can take a look at the image, which gives you a lot more by that time you'll have more context before you actually look at the image. And as like I said, a lot of times it can be answered from the history alone. Pharmacology. Okay, so again, it's one of those crammable subjects, just like biochemistry and micro, as we had discussed earlier. Think about the prototypical drugs and the major variants. If you do want to score well, then you're going to, obviously learn the minor variants, but understand the mechanisms. And hey, if it's a penicillin, if it's a lactin side chain, what is that? If it's bulky or less bulky, what does that do or not do? So those are the things that you want to keep in mind. The major categories, are covered in first aid. So you see it here. And again, like microbiology, It is about, the information tends to be fairly, the types of things that they test about is fairly regularized. So it's going to be mechanism of action, clinical uses, toxicity, and drug-drug interactions. And again, because it is about treatment and management, almost always it will be tied to a clinical vignette and tied potentially to another concept. Physiology, often tied to pathology, so pathophysiology, as I mentioned earlier, tends to be concept-oriented. That's why diagrams often work well in terms of mapping it out. So in understanding all the various relationships, like the HPA axis and stuff like that. In terms of understanding those relationships, and again, almost always incorporate into some sort of case-based question. All right, psychiatry, on step one, that includes psychology, sociology, psychopharmacology. We tend to think about the mood disorders, but there's a number of other high-yield areas like personality disorders, and again, these are all well covered in first aid, or at least we'll at least point you to it, as part of your overall prep. And then finally, public health. So this includes biostats, epi, ethics, and then more recently, they've been adding more and more questions about healthcare delivery, patient safety, and quality improvement. In fact, they're going to be adding some more by next summer. It's already been there for a couple of years, but I think they're going to increase the percentage. Biostats and epi by itself tends to be high yield because that's often classified under system-based practice and practice-based learning and improvement. So one of the Institute of Medicine competencies, and then this is also where some of the clinical skills or communication skills come in with doctor-patient interactions. All right, so that was a quick walk through that, and as I mentioned, it's all on the blog, and so there will be, so you can get the slides later, and I'll show you exactly how to do it. Now let's talk a little bit about review resources. There's many resources out there. There's text reviews, excuse me, high yield text just like first aid, QBanks like USMLE-Rx, question reviews, case-based reviews, review courses, and then all kinds of digital resources like apps, videos, flashcards, and all kinds of stuff. So so there's a couple of things that you need to think about when picking and choosing resources. First, you want to check out the resource reviews in first aid for the USMLE Step 1. We have abbreviated reviews with ratings in the back of your first aid book, but on our blog we actually have a bigger, if you will, kind of buying guide, if you will, kind of like consumers report, where we survey about 1,000 students and IMGs, U.S. and throughout the world, and get their opinions, and then our editorial team, provides some rough recommendations. Once you know what you want to use, you want to start using those resources early. Use them as part of your day-to-day study, while you're in class, while you're out of class, that type of stuff. That being said, be judicious about what you use. There are literally hundreds of resources out there, and you're probably only going to be using a dozen and a half, or something like that, so or less. So just be judicious. You can always usually get these things on demand. And then finally, for some certain resources, certain things are good for one subject, but not good for another subject or discipline. So just keep that in mind. All right. So I'm going to ask 2 more questions as we kind of get into the home stretch here. So the first of the 2 questions is, what resources are you going to be using to prepare for your boards? Is it one of the above or all of the above? So just remember that this is all, you can choose more than one. It could be all of the above or just a couple. So take your time, because I know this is a little bit more, some of you guys might have to think about it, because some of you might not even have started studying yet. And I get that, no worries. All right, about a third of you guys have answered. We're definitely going to wait a couple more seconds on this because it's always like good to see what people are picking out there. All right, about 2/3 of you guys have answered, so I think that's good enough. I'm going to go ahead and close the polls and share. And so what you see here is that almost everybody's going to be using question banks. Most people will be using review books and videos, and then flashcards and mobile apps aren't far behind. So a big mix of resources out there. All right, and I'm seeing some questions about the resource guide. I will definitely show that on our blog, so you can download that if you want to. It's our contribution to the student and IMG community. All right, so let's talk about some general advice, and I'm certainly going to ask Mark and Sean to jump in just a little bit here, because I know they've been giving students a lot of advice here as part of our RX coaching program and tutoring program here. So a couple of things. Let me close the poll here so it doesn't obscure all this. So in general, when we talk to students and we talk to pinpointed their successful habits of doing well in the USMLE Step 1, there's a couple of things that tend to stick out. One is you have to plan ahead. You do need to plan ahead, and you want to come in with a framework for approaching the exam. You want to once you establish a study schedule, you should be able to stick with it if you follow a couple of simple rules. One is you don't over schedule, so make sure you got times for breaks, exercise, personal issue. I strongly recommend taking a day off a week, especially even during the dedicated time, and also try to get through your primary studying at least a week before the exam if you have that luxury, so that you can you've got some of that time left over to go back and work on some tough areas or do some additional testing. We do have and again, that's all about staying relaxed and grounded and making sure that you don't burn out. You got to peak at the right time. We do have a checklist in the front of the book. It's right after all the acknowledgments, where we do all our thank yous and stuff like that. But before chapter 1, right before chapter 1, there's a checklist that'll keep you organized, especially in the weeks and months ahead. So if you do that, then you should be able to stick with that study schedule and not have to make too many adjustments. The other thing that's a major piece of advice is, when you learn something, you should immediately try to integrate it and apply it to something else. And so if you learn something about an antibiotic and about its mechanism of action, then tie it back to the molecular biology about how it how it inhibits DNA gyrase or something like that, in that bacteria. So take the pharmacology and integrate it with the biochemistry / molecular biology. So integrate, apply, and because again, that's how the USMLE will do it. They're going to give you multi-step questions, and they're going to start with the subject with clinical scenario, but then they may ask about the molecular biomechanism, or they'll start with a clinical scenario. You make the diagnosis, and then it may ask for treatment, but then it may also ask, hey, what's the mechanism of action for that drug? We talk about those scrambled subjects like molecular biology, again, particularly metabolic pathways and pharmacology, that because they have regular structure, they tend to be a little bit more crammable. I know nobody wants to cram, and you shouldn't cram, absolutely, but at the very end, you're going to be doing a little bit of cramming, and that's where you might be saving some of those high yield subjects, if you want to refreshen up on them. And then finally, think about focusing on the high yield material that you have previously learned. Again, if you had a proper and a good quality medical education, it should cover the vast majority of the subjects that's likely to show up on the boards. And so, relearn that stuff first, and then, if there's stuff that you haven't learned but it's considered high yield, save that for a little later. So at this point, I'm going to, open it up to Sean and Mark, see if they have just any general advice that they have been given to, the ARCS coach, mentees and all that, over the last couple of months.
Yeah, so I'll chime in here, and Dr. Lee has said this several times in our webinars before. There's a lot of questions out there about should we do the same question more than one time? We're seeing a lot of those questions today as well. We always tell our students that really, there's no evidence to show that doing the same question more than once is going to, same question being doing it more than once is going to actually help you increase your score. We do recommend, however, that you do at least 3,500 questions, keep a study schedule, take a subject-based approach, and if you need help, feel free to reach out. We are going to be sharing our link for free consultations about our tutoring program, and we'd love to help you in any way possible.
Yeah, and I also agree with that. I think because there's multiple ways that a certain topic or concept can be presented in a question, so I think seeing that in multiple different questions is important, as opposed to kind of just doing the same question over again, because you're really only seeing it from one angle. So I think it's important, like Sean was saying, to kind of just do is really as many questions as new questions as possible. And really the way to kind of go back to those old questions is kind of just looking through first aid, kind of hammering down those concepts by, reading and doing the flashcards. I think that's kind of probably a little better approach than doing the same question again.
Great. Appreciate the advice and the nuggets there. All right, let's keep going. So let's talk about computer-based testing. That's what CBT stands for. As I mentioned, there's that tutorial at the very beginning that tells you how to use the program. And again, do it at home before you go to the Prometric Test Center so you can save 15 minutes. There are some keyboard shortcuts just in case you're interested. And again, just do lots of computerized tests, QBanks and so forth. And it's really critical to be doing it all the way through your studying and really as part of your curriculum as well. And there turns out to be actually a lot of scientific evidence for that, and we'll jump into it a little bit. So the one of the bigger studies was done out of University of Purdue several years ago, where they actually took college students and they basically randomized them to 4 study methods and then tested them 1 week later. And it turns out that, and they were all, by the way, given the same amount of time. Nobody had any more time, but they had to study one particular way. And so what they found out is that basically that students who basically self-tested themselves, and this is retrieval practice, the term is called retrieval practice, but it's basically self-testing. They did better, as you can see here, than people who did repeated studying, which is essentially cramming, or just studying it once, or concept mapping. And even if the questions were a little more complex, so they were inference questions, they still ended up doing better. So that was a pretty impressive study, but there's plenty of other studies in the literature that have very similar. So this is really well recognized. So basically, you can learn a lot through self-testing yourself, and not just cram and just passively read all the time. So what are the computer-based testing practice options out there? Obviously, there's the USMLE sample test you can download. It's helpful for format familiarity with those 120 or so items. The only problem is that some of those items might be a bit old and maybe not as representative of the exam. The NBB-CBSSA is a little bit more representative. They're up to Form 24 or something like that. There's 6 to 8 forms that are out there. They're roughly 50, 60 bucks. When you get the comprehensive basic self-science self-assessment form, you have about a month or 2 to use them. And then what happens is then they'll give you a histogram of your performance. They won't give you any explanations, and in the basic form, they also don't give you the correct answers either. But it is the performance on these things can be predictive of the USMLE Step 1. And then there's the question banks like USMLE-Rx, UWorld, and so forth. And so these are great for practice studying and simulation. And for as a matter of fact, with USMLE-Rx, you can set aside questions and do your own simulation, even in addition to the self-assessment exam that we already have included in the package. And it is predictive of USMLE Step 1 scores. And so speaking of which, let's talk a little bit about the research that we know about QBanks and other test prep methodologies and how well it does for USMLE Step 1. So the key thing here is that question banks are superior to flashcards. So flashcards are fine. You can do it can help you on the USMLE Step 1, but question banks are absolutely superior. And the part of the explanation why is that you're practicing with questions that look like the real thing, which is of course while flashcards are not the real thing, they don't look anything like a USMLE Step 1 question. They can get you the components, but they don't get you the whole thing. So the next question is, well, how many questions do you need to do well? So the research has broken it down to that you roughly need to do anywhere between 300 and 450 questions to get one additional point on the USMLE Step 1. Controlling for your MCAT and your GPA. We did our own study, and for USMLE-Rx, you only had to do 260 or 265 questions to get an extra point on Step 1. So the lower than so you have, in other words, you had to do fewer. It took fewer USMLE-Rx questions. So in fact, if you did the entire USMLE-Rx question bank, that should roughly translate to 10 questions on the board, controlling again for MCAT and GPA. In terms of how many questions in total you need to do, nobody knows for sure. The Michigan study was, their top level was 3,200, but they didn't go higher. So again, we're a little conservative. You heard Sean say 3,500. So we think that's an overall number. But you can push it higher to 4,000. More power to you. We don't know what the top, where the curve flattens out, at the moment. Nobody has done that study. Sean mentioned again, it's the same thing Mark said. It's really doing unique questions that actually gets you the highest score. Repeating questions don't work. Now, if you still need to learn a topic, great. If you want to go back and learn something, but in terms of the actual predictiveness of course, in terms of doing better on Step 1, it has to be unique questions. And so that's why people have to do at least a minimum of 2 question banks, possibly even 3 question banks. And then finally, using first aid. Obviously, we're biased, but the people who did the study at the University of Michigan basically said that people who did at least 3 passes through first aid did better than those who did not. And so we generally recommend that if you're using USMLE-Rx, use ARCS 360, use our flashbacks, because each of our flashcards is basically tied to first aid. So when you get the answer, you also get first aid. And so if you do all 10,000 flashcards, then you will get through first aid 4 or 5 times just by doing that in an active learning way, using active learning questions as opposed to passively learning. So that's going to be the more effective way to do it. So that's what the research says. All right, so let's talk about test day here. Just a couple of things to keep in mind. Think about your judicious use of stimulants. Remember that you're going to be in an office building. It's often cold. The majority of the time they're cold. Sometimes you might get a little heat because of direct sunlight on the side of the building, but they're usually tinted windows. But nevertheless, wear layered clothing so you can be comfortable. The majority of the questions will have medium stems or short stems, but occasionally you'll run into a question that has a big fat stem or big fat vignette. So if you run into that scenario, you might want to look at the lead-in first. So you might want to find out, hey, are they asking about the diagnosis? Are they asking about the treatment? Are they asking about the mechanism? Then scan the distractors or the answer choices. Then go back and then read the vignette. With regards to the clock, you got 40 questions per block in a 60-minute block, and so that roughly equates to 90 seconds per question. But what we strongly recommend you do is that you make a commitment. You commit to an answer within 70 to 75 seconds. So if you do that, that would normally give you 12, maybe even 15 minutes at the end, where you can, if you've marked what you think might be the solvable questions, you can go back and work on them. Just don't mark too many questions. You've got, you won't be able to get through all the questions that you marked up. And related to that, the evidence that shows that second guessing yourself, while it can be a little more, anxiety-inducing, actually helps. There's evidence that if you go back and you have a good reason to change your answer, then go ahead and do it, because you'll do slightly better on average, according to the NBME themselves in their own research. As I mentioned, you should have plenty of time for breaks. especially if you can finish some blocks early. It's up to you how you do it, but some people will do 2 blocks, take a break, 2 blocks, take a break, in snacks and this, that, and the other in between. Some people do 3 blocks, then 2 and 2. It really just depends. Again, in USMLE-Rx, you can set up a full day simulation, set aside 280 questions, do that in a full day, and give yourself a sense of where your energy level is, so that you can strategically place your breaks and so forth. My study group back in med school, we joked about the C reflex. So in other words, there will be some times where you will have no idea what's going on that particular question. Just keep a couple of things in mind. Number one, it could be an experimental question, and number two, there's a range. There's going to be some very easy questions, and of course there are going to be some very hard questions, on the boards. And so your job is to see if it's solvable. If it's solvable, spend the time. If it's not solvable, then cut your losses early. Pick C or your favorite letter, and then move on. And then finally, this is a question that was given to me my first day of medical school. Generally, as long as you pass, you've got a shot. Obviously, if you're looking for a competitive specialty or you're an IMG, you're probably going to be looking for a higher score. But in general, if you can get past through that hurdle, the majority will see success in the match, and hopefully be able to match into something that you're happy doing. All right, so at this point, what I'm going to do is shift a little bit and talk a little bit about, as I mentioned, some of the new things that we're launching. We're really excited about. The one thing that I'm really excited, well, there's 2 things. So we just launched RX Bricks, 6 months ago, and we're building it up. These are modular learning experiences where we cover all the core things that you need to learn in medical school. Not only to do well on the boards, but to be really a good doctor, which is the whole point of medical school, right? It's not an exam. It's really to become a good doctor that can take good care of patients. We do things that other textbooks don't. It's clear language explanation, great mnemonics, interactive flashcards, basically, and study tools such as summaries, analytics, progress meters, and also with the deep integration to first aid and USMLE-Rx. And so I'm going to just switch here and show it to you. So again, let me just refresh this just in case this got stale here. So when you log in, this is the dashboard. When you get to the hamburger menu, you can go here and see the bricks. Obviously, our question bank, flashcards, express all this stuff is here. But most of you guys already know it, and I know a lot of you guys are using us. So I won't go through this, but I'm going to talk a little bit about the bricks because this may be new to you guys. As you can see here, we've got lots of collections of bricks here. You can see when you get in, you can see what was the last collection I was working on, how many collections I've done, how many bricks have I completed, how many days have I studied, how many questions have I answered. And then as you go through, you can see, hey, there's roughly 10 collections of bricks, and we've got more collections coming. Most of them will be out there by the end of winter, so sometime early next year. But if you go into one, let's say we go into cardiovascular, you can see all the topics, and you can see there's an integration of anatomy, pathology, physiology, and so forth. And you can see all the various topics. And so let's grab one here. Let's grab emboli here, and you can see that we tell you how much time that you might want to budget for it. It's a very clean learning interface, so you don't get distracted. When you go through it, you'll notice that this doesn't read like a textbook at all. It's very friendly, it's very conversational and casual. It's like your favorite professor sitting down. Hey, let's start with a couple of basic things here, and then we'll build our way up so that you don't get confused and you don't get lost. You see that we have beautiful images that you can zoom in, and you can highlight and annotate. Type in your notes. You can even drag and drop images. Create your own notebook. If you have, you want to give us feedback, you can even do that. Send us anything, just like in first aid. If you pick up an error or you can, help us make it better, we'll give you an Amazon gift certificate, right? And then as you go through, and also there's highlighting too as well too. And as you go through it, you'll notice that we embed flashcards. So we are continuously testing you. So you saw how the researcher showed you. The more questions you do, the better you do. So we are going to ask you questions all the way through your learning experience, we're going to ask you, as part of within the brick, we'll ask you when you are, going through the actual text. So you're always thinking, you're always, learning, you're always applying, not passively reading and not passively watching some video. You're actively, this is all about active learning. And as you go through it, as I mentioned, everything is well illustrated. There are clinical correlations. Even the mnemonics are interactive. So, you'll see some of your favorite first aid mnemonics here. And then when you flip them, you can actually test yourself. So what are the 6 P's of acute limb ischemia? Well, it is, power, pain, polythermia, and so forth, right? So again, we're always testing you. And again, so you see it, with almost every major learning objective. And at the very end, I'm just gonna skip to the very end. You've got a high yield summary that's linked to the learning objectives. You got practice questions. Some of them are case-based, some of them are not. And then when you go through them, you can't get the explanation until you get the answer correct. You saw that I got on the second try, and then it provides, the explanation, so you understand why C was incorrect, but then why B was correct. And then at the very end, I'm going to skip this. Well, you can, this keeps you honest. This allows you to track about, hey, which learning objectives you really learn. And then if you really do want to go deeper, particularly if you want to get into test prep later on, then you can actually, if you got the full RX 360 package with the bricks, then you can actually, we will take you directly, one click to first aid, and to the 2 key facts that are tied to that particular, topic. So you click here, and then you're into first aid. You can again do all the same thing that I just saw there: highlight, annotate. You can even go further. You can you can then go into and do flashcards. So now you can do some flashcards on this. So you can see there's some flashcards with some images, and you see that we're the only flashcards that takes you back directly into first aid. So again, if you do all these flashcards, then you'll be going through first aid multiple times, but as part of an active learning process, not again just reading and highlighting, right? And we keep this all on the timelines. So if you want to go back to where you started and say, oh wait a minute, where did I start on that brick? Oh, I can go back to first aid, or I can go all the way back to emboli and get back to exactly where I started. Then, oh, if I want to watch some high yield videos, I can do that. If I want to do some USMLE style questions, I can do that. And so it's all, you can all keep it all in one place. It's all integrated. And again, if you want to do USMLE style questions that are more intense than the end of the block questions, you can do those too as well, and then come right back. So that's the basic walkthrough of the brick. And then you can, when you're done, you can go to the next brick basically curate your own learning. So far, we've gotten a ton of great feedback on the bricks. Students have basically just said, hey, these things are a great way to learn. So accessible. If they when they click, sometimes these things can be really transformative. Some people have just said, hey, look, this is the first time I truly understood something, was when I went through your bricks to learn something that was really abstract. So those are the bricks. Do check them out. And if you happen to be an RX 360 user, you do actually have some sample bricks you can look at. And then the next thing I want to mention is that we have a new coaching and tutoring program. So this is by USMLE-Rx. This is by the same team that brings you first aid. All of our tutors goes through a rigorous certification and training process. As part of this, you get access to USMLE-Rx 360, that because it's part of the program. We do give you a 160-item assessment to get you baseline, and then there's scheduling tools so you can easily work with your tutors. So if you have an interest, you can go to this URL, which is cut.ly/rx-coach. So cut.ly, 2 T's, rx.coach, if you want to get more information about this. So again, those are the 2 things that we're really excited about. So as I mentioned, as I promised, we do have a raffle. And so, we are going to be raffling off 5 sessions of RX Coach and 6 months of RX Bricks and RX 360. This is truly a complete learning system with live training and digital resources. And so each package is worth $1,000 roughly. And so I'm going to grab a couple of names here, and so you have to be here to claim your prize. And let me grab the names. And so the 2 winners are Paula Alba and Colin Young. If Paula Alba, so I just drew your names out of a hat. So if Paula Alba and Colin Young are here, I need you to type your name in the question box, Q&A box. So I'll give you guys about 20 seconds, and if you don't claim it, then we'll give it to somebody else. So I'm looking for Paula Alba and Colin Young. Type your name into the Q&A box so I know that it's you. All right, Paula Alba and Colin Young. So going once, going twice. All right, let's draw two more names. Rut Velez, R-U-T Velez, and okay, Colin Young is here. Good. So I'm now looking for Rut Velez. Okay, great, Rut Velez. So you guys got the 5 coaching sessions, 1 hour each, and 6 months of RX 360 and RX Bricks. Congratulations. That's fantastic. But hey, if you didn't get something, we still have something for everyone else. And so we do have a special webinar offer. This is for RX 360 and Bricks. It doesn't apply for RX Coach. We have a special holiday code, Holiday Path. As you can see there, Holiday, I believe it's capital H Holiday and capital Path, P-A-T-H. You get 33% off any new subscription. So this is good for 2 days, and that's through Thursday.
Everybody hang on.
So, do take advantage of that. Hello? Hello, can you hear me?
Yeah, you just dropped off, but you're back.
Okay, great. I apologize. So I just wanted to finish up by saying that we're out there. We're out there. We are part of a global community. If we didn't answer your question specifically tonight, you can reach out to us on social media. We'll do our best. We know that we're literally hundreds of people out there tonight, so we try to answer as many questions as we can. As I mentioned, there's a blog. So let me go to the blog. So you saw that as firstaidteam.com, right? So here it is, firstaidteam.com right there. We've got a lot of free stuff here. So if you click on the bonus stuff, as I mentioned, there's a couple of resources here. So all the top rated resources are here. Also, first section 1 supplements here. So for the IMGs that are out there, and I know that the majority of folks are IMGs, you should go to the First Aid's supplement, because that's where we often have specific advice for US and international born IMGs about going through the ECFMG process and so forth. The other thing is, if you're looking for the presentations, you can click here, and then you can get a video, access to video in a recent PDF of one of my recent presentations for First Aid Step 1. So those are the resources out there. With that, I am going to wrap it up. Bring it back here. So if you need to, grab the special code, use it or share it with a friend, you can go ahead and grab it right now. So I'm going to open it up for questions. So I'm wondering, Sean, Mark, thematically, what type of questions are you seeing out there that we want to address?
Dr. Lee, we're seeing a lot of questions about the updates coming to the USMLE for 2020. how many more questions will be added, and what the content areas will be that those questions will be added to.
All right. So overall, the exam it will be the same number of questions. It'll be 280 questions. What they're going to be doing is they're going to be increasing, and we don't know by what percentage. They're going to be increasing the percentage of some of the healthcare delivery, patient safety, patient communication, professionalism questions. So those are going to go up. So the good news is we already cover that in USMLE-Rx, and we already cover that in first aid. Obviously, we're going to be monitoring this very closely to see exactly where they go, but all the basic concepts are there. They're in our question bank. They're also in first aid. We'll continue to watch. We'll probably continue to beef it up. So that's what we expect to see in May 2020. We don't expect them to be testing them any differently. It's just that there's just going to be a higher percentage of those items, but overall it'll still be 280 questions. All right. What other general questions are we seeing out there?
I guess a common question I also saw is kind of what the difference was between the international and the U.S. version of first aid was a question I saw pretty frequently.
There shouldn't be a difference between we're talking about the first aid book. It should be the same book, except the international book may be printed at a different place, so it may have a different paper and a different cover, but it's the same information inside the book. All right. Any other general questions or things that are kind of showing up frequently? Have we pretty much covered the waterfront?
Yeah, I think so.
Yes, Dr. Lee, that seems to cover it. Just a heads up, we did send out the link for the, if you want more information about RX Coach, into the question box. If you check that, you'll see a link if you want to click it and access it more easily.
All right, so yeah, so if you weren't able to write this down, sounds like they were, it's in the chat box, and it's going to be emailed to you folks later on as well. Okay, excellent. So if we're good, I'd like to go ahead and wrap it up. First of all, I want to thank our fantastic panelists for spending time answering your questions. So again, thank you, Sean. Thank you, Mark. Also want to thank the rest of the ScholarX team and first aid team that was here, Jeff Downing and Louise Peterson, who helped answer questions in the background and as well. So hopefully, between most of these, all the guys, we got you guys some answers. And again, if we weren't able to get all your questions answered, don't hesitate to give us a jingle on social media, Facebook, Instagram, follow us or like us. And as I mentioned, there's a lot of free resources there as well too, both on Twitter and Instagram and Facebook, where we often have free flashcards and questions. And do give us feedback. First Aid and ScholarX, we are a global student community. We rely on each other. We help each other. And so when you are done with your boards, when you've gone through and gotten the score of your dreams, then do write us back. Tell us how you did it. Tell us how you used our resources, and so we can pass on that advice to other students and of course improve what we do. So again, thank you guys very much. Hope everyone has a good night. And hope everybody has a good holiday and good end of the year. Good luck with your boards. Again, don't forget to write us when you're done. And good luck. Take care and good night. And thanks, Sean. Thanks, Mark. Thanks, Jeff. Thanks, Louise. Good night, guys.